Here's Michael Quintana, and he's came in with probably one of the worst fibromyalgia cases I've ever seen after a severe car accident. How many years ago was that?
About 5.
Yeah, and ever since, could you describe the symptoms you've had to the camera?
A lot of brain fog, attacks, painful attacks.
Could you describe the attacks? Where?
The attacks happen in my head, and then they shoot a lot of pain. It actually begins in my lower back, and it crawls up to my head, and then all my back and shoulders.
What part of your head is the headache attack?
The right side. The right side, and right here in the center of my
The
forehead.
parietal lobe right here.
Yeah.
Yeah, I remember when I was consulting with you, like you had an attack, and
Oh yeah.
you were like, your face turned red, and it was like you're biting,
Right.
yeah, your teeth, and
Those happen.
I'm going to explain the mechanism of a cervicogenic headache. Can you focus on this? All right, so when you have a car accident, you're hit from behind, so your C1 vertebra is shoved forward, and that puts pressure on the upper meningeal nerves, COC1 and C1C2, and the blood vessels. These blood vessels through the vertebral and carotid arteries supplies, the branches of the blood that go to the brain, okay? Now, because they're being pinched here, there's less blood supply going to the brain, so the blood vessels in your brain have to expand to get more circulation. And when they expand, what happens is it causes a rush of blood in the head, and that puts pressure on the meninges, the nerves here, so you get these transient headache attacks. And this happens, randomly. So now that we're decreasing the inflammation on the nerves and the blood vessels, what the laser and magnets is doing is creating nitric oxide, which expands the blood vessels in the cervical spine, delivering more oxygen blood to the brain, the vasculature, and that puts less pressure on the nerves because these vessels are not expanding, and that's why his headaches, your extra pain in your whole body is down, at least 50-60%, correct?
It is.
Yeah. So let's film on this again. Let me go over the mechanism, make sure that's clear. Blood vessels in the head expand to offset reduced blood supply. Sudden expansion irritates surrounding nerves. The throbbing pain causes a migraine attack right here. And in Mitchell's case, it's right here, right around the parietal lobe, right there. So, and these misaligned vertebra, they can put pressure on these vessels or irritate the spinal nerve meninges here, and that's the mechanism of why he's getting pain up in the brain. This also puts pressure on the spinal cord, which goes all the way down to his lumbar spine. That's why he's feeling pain down there. So these pressured blood vessels reduce blood flow for the brain. Irritated nerves may tell vessels to narrow, further reducing blood flow. But now that we're expanding that and getting pressure off those nerves through the pulsed electromagnetic waves and the cold laser, photonic energy to reduce the inflammation and swelling, so the nerves and the blood vessels could actually function normally. Now what we're also doing is we're stimulating his brain fog through the LED blue lights to normalize his brain waves, because you're probably you got insomnia since the accident.
Well, I use sleeping pills to be
Yeah.
able to sleep.
Yeah, and basically that's because his sympathetic nervous system is
Otherwise
jacked
I can't
up.
sleep.
Yeah, he can't sleep with the sleeping pills, but he'll probably have to throw the sleeping pills out.
There
'cause
is a very
Yeah.
strange sensation,
Yeah.
and that is when I went back to work Tuesday, I had to get used to not feeling pain.
Yeah.
It is a very strange sensation.
Yeah, because you
To
forgot
not
how
have
it
pain.
felt to be normal without
Yes.
pain. Isn't that incredible?
And I'm trying to walk around. I'm like, I'm trying to find that pain, and it's not there.
And when you first walked in, on a scale of 1 to 10, it was 12 off the
12.
charts, right?
Beyond that.
Yeah. And then what we're doing here, this magnet bed puts pulse electromagnetic field waves into his brainstem, and in the upper part of the brainstem, called the mesencephalon, that's where the reticular activating system is, which is the part of your brainstem that wakes you up in the morning. And that was damaged in the accident, so his sympathetic nervous system is always keeping him awake. That's why he can't relax. So the LED neurofeedback therapy lights will relax his brain to bring those waves down, alpha, beta, theta, delta. And also the magnet will help his brain stem to function normally. Because 90% of the pain fibers that go through the brain, they pass through the brainstem. 90% of those signals are dumped off in this brainstem, activating the sympathetic nervous system. All the cranial nerves are there. And now this is going to take the pressure off that, because now the pain signals are being decreased because we're taking the pressure off the nerves in his upper neck. And we get to the source of fibromyalgia. Fibromyalgia is just a label. You know, it's not a disease that's incurable. All we do is get to the source, the nerve injury in the upper neck, and take the pressure off the nerves and the blood vessels. Everything else takes care of himself. Now, what medications have you been on for this for the last several years?
Oxycodone, gabapentin.
Yeah, and gabapentin's an anti-seizure medication. It's not even, but they use it for pain. It doesn't even really work. Probably causes a lot of side effects. The OxyContin is an opioid. It causes addictions. So, and they want you on this for the rest of your life. And fentanyl, all these non-steroidal anti-inflammatories, which causes ulcers in the small intestine. It's not good, but if we can wean them off all these drugs and get to the source of this, he could have his life back. So I'm thrilled. This is treatment number 2?
Yes.
And 50-60% better. It's a miracle in my book. All right, let's chalk it up. Let's continue. All right, any last words?
No, not for right now.
All right, there you go.